To assess cranial nerve 1, the olfactory nerve, the examiner will have the patient close their eyes, plug one nostril at a time, and then smell something and identify the smell. If the cranial nerve is damaged, they will not be able to smell out of the ipsilateral nostril.
To assess cranial nerve 2, the optic nerve, the examiner will give the patient a vision test. The patient will cover one eye at a time and read the chart. If this cranial nerve is damaged, they will not be able to see out of the ipsilateral eye.
To assess cranial nerve 3, the oculomotor nerve, the examiner will check pupil dilation with a pen light along with eyelid symmetry. If this cranial nerve is damaged, the pupil will not react to the light stimulation and the eyelids may appear to be asymmetrical.
To assess cranial nerve 4, the trochlear nerve, the examiner will have the patient look straight ahead. Damage to this cranial nerve will result in eye deviation superiorly and laterally.
To assess cranial nerve 5, the trigeminal nerve, the examiner will have the patient close their eyes and run a pen along their face in the form of a 3, along the forehead, down the cheek, and along the mandible. The patient will tell the examiner if they can feel the sensation. Additionally, the examiner will have the patient open and close their mouth in a biting motion. Damage to this cranial nerve will result in loss of sensation to parts of the face or ipsilateral deviation of the jaw.
To assess cranial nerve 6, the abducens nerve, the examiner will have the patient look straight ahead and track the examiner's finger with their eyes. Damage to this cranial nerve will result in medial eye deviation and or an inability to move the eye laterally.
To assess cranial nerve 7, the facial nerve, the examiner will have the patient smile, raise their eyebrows, scrunch their forehead, and puff out their cheeks. If this cranial nerve is damaged, the patient will have a deficit or weakness on one side of the face.
To assess cranial nerve 8, the vestibular cochlear nerve, the examiner will have the patient close their eyes and the examiner will rub her fingers near the patient's ears to see if the patient can hear the sound. The examiner will also have the patient close their eyes and stand on one foot to test their balance. Damage to this cranial nerve will result in a possible hearing loss or issues in balancing.
To assess cranial nerve 9, the glossopharyngeal nerve, the examiner will test the patient's gag reflex with a tongue depressor. Damage to this cranial nerve can result in a lack of gag reflex and a lack of taste on the posterior 1/3 of the tongue.
To assess cranial nerve 10, the vagus nerve, the examiner will ask the patient to stick out their tongue. The examiner will observe the uvula to see if it deviates. The examiner will also ask the patient to speak. If the nerve is damaged, the uvula will deviate contralaterally and the patient may display a hoarse and or weak voice.
To assess cranial nerve 11, the accessory nerve, the examiner will ask the patient to shrug each shoulder and turn her head to the left and the right. If the nerve is damaged, the patient will display difficulty shrugging the ipsilateral shoulder and will not be able to turn her head contralaterally. As you can see, the patient was unable to shrug her right shoulder and could not turn her head to the left. This is an indication that the right cranial nerve 11 is damaged.
To assess cranial nerve 12, the hypoglossal nerve, the examiner will have the patient stick out their tongue. If the cranial nerve is damaged, the tongue will deviate contralaterally.